targets the pancreas. And so this here, to orientate you, this is the small intestine, and this organ here is the pancreas. Now if you zoom into the next one, this is zoomed in close up. And so that should be a uniform, sort of pinkish gland. And all of these spots here, where it's bleeding and bruised into itself. So what the pancreas does, it produces insulin like it does in us. This is type 3 diabetes. So that's diabetes induced because the pancreas itself is damaged to the point where it can no longer produce enough insulin. And what insulin does is it moves sugar from the bloodstream into the system where it can utilise it. So what PMV birds can't do is they don't have access to an energy source. And what the kidney did, if we just go back again, so we go into the kidney, what the kidney has to do is not only excrete the body's wastes, but it has to maintain a normal level of hydration. So what happens when we're thirsty, we drink, and because our kidneys are working well, the kidney keeps the fluid back into the body that we need. If the kidneys aren't working properly, they can't do that. So we just drink, goes into the bloodstream, and the kidneys just filter it out like it's going down the plug hole. And that's why when you see pigeons with PMV, most of us will have seen that, they have these big fluid-filled crops and the huge wet patches of urine on the floor. So because they are drinking and drinking, but just going straight through their system, you're getting the big pools of urine on the floor. No matter how much they drink, they can't hydrate themselves. So they're drinking so much that their crop is literally full of water all the time. So these PMV birds, they can't maintain hydration, they can't access the energy in their food, and of course, we're not aiming to just identify the ones that are really crook. We're looking to protect the race team so they can perform at their best. So you sort of think, okay, if a bird's 10% affected, if that's a breeding stock hen, that's okay. You know, she doesn't have to, utilise her food to the best. She can go and drink a bit more if she needs to. But if she's a race bird, if she was 10% compromised, 5%, 25% compromised, can that bird even get home? But of course, we're not even aiming to just get them home. We want them to get, home quickly, and we want them to win. So it's one of these diseases. It's a season killer. If you get PMV into your loft before your pigeons are fully immune, they might look okay, but if you autopsy them, you'll find that degree of damage to a variable extent affected by just how immune they are when they're exposed. Thank you. So, how to use the vaccines. The salmonella is by far the easiest one. It's remarkably cheap. $110 if you just buy it from Bioproperties for 1,000 doses, so it doesn't get much cheaper than that. So as we were saying, it's a live modified one. You're giving them the live vaccine, live bacteria. They have the bacteria in their system for a couple of hours, then the bacteria die. The immune system's exposed to both the toxin it produces before it dies and the protein. It comes as a little freeze-dried pellet, just like the pigeon pox that you'd be familiar with. And that freeze-dried pellet is enough to do 1,000 pigeons. And it's got to be used within 2 hours. It's diluted down, and it's got to be used within 2 hours. So no one, or very few of us, have got 1,000 pigeons. Because we can give it 3 ways, either dilute that pellet down with 100 mils of water to make 1,000 doses, and then from there you can either inject it under the skin, give it orally, or put it in the drinking water at this rate, dilute it down 10 mils to 5 litres. The restriction is that it's got to be drunk within 2 hours, which is pretty hard. But the thing is, if you're giving it orally, you don't have to be sterile. And so it is possible to partition the pellet. So what you would do is, you've got, you can cut the pellet in half, dissolve that into 50 mils of water, which is 500 oral doses, or a quarter of a pellet, 250 mils of water, which is 250 oral doses. So it's really, very good. So you just get it with a Stanley knife. Don't have to, you have to be sterile if you're injecting it, but most people give it orally. So you can just use tap water in Australia, quarter of a pellet, 25 mils of water, 250 doses. Go back 4 to 6 weeks later, reconstitute another quarter, another 250 doses, and give that orally. Thank you. But of course the thing is, vaccines are preventative. They don't treat the disease if it's already there, so you've got to use the vaccine in pigeons that haven't got salmonella in their system. And so if you have salmonella in the loft, you suspect it's there, and you just go and vaccinate them, you are only protecting the birds that as yet haven't caught it. And so usually what we try and do is make every effort to make sure that as many of the birds are free of salmonella before we vaccinate them. And so doing that, we grade lofts into various degrees of infection. So most racing lofts, there's no history of salmonella, there's no active salmonella in the birds now, and so you just vaccinate them, that's fine. And it's important, like a lot of Australian fanciers think that when they say salmonella, they think of swollen joints and wobbly flights, but that's only one form of salmonella. You know, I was lucky enough in 2019 to work in Belgium for a period of time, and they're much more switched on with salmonella as a potential cause of poor race form. And what they associate salmonella with is just wet droppings after a period of stress, loose droppings. You'll grow salmonella out of the bowel of many, many pigeons. It's almost a normal bacteria there, but they don't get sick with the disease because they're immune to it, and the bowel wall won't let the body absorb that salmonella. It's the same as most of us sitting in this room here now have bacteria in our bowel that if our immune systems weren't working would kill us. You know, if we had, you know, we've got E. coli and a whole range of other nasty bugs in our bowel, but because we're healthy and we're immune to those, they don't penetrate the bowel wall and get into our body. And salmonella is the same in pigeons. It's one of those things that just cycles through race units. Pigeons carry it, they're not showing any signs themselves. They go in the unit, they poo on the straw, the other pigeons scratch around, you know, drink, eat, it's, you know, plenty of exposure there. And in days gone by, what used to happen is pigeons would get a bit loose, or it's like diarrhoea, you know, after a hard fly or whatever, and people would either do nothing and just care for them well, and the birds would then fix themselves, and the immune system would kick in as the birds, you know, regained their vigour after a hard fly, and they'd fix themselves. Or alternatively, people would, you know, give them a few days on sulphur AVS, and the droppings had come good, and the pigeons looked bright, and you wouldn't really know what you treated. So it's tremendously underdiagnosed. So that's why we vaccinate racing pigeons in Australia against salmonella. Not so much, even though it protects against all forms of the disease, but we're not vaccinating them to prevent against the really obvious joint forms of the disease and the brain forms of the disease. We've got the twisted necks and things like that. We're vaccinating them to stop the bacteria invading the wall of the bowel and causing a transient enteritis in a stressed race bird and cause the resultant loss of form. So if you've got racing off with a history of salmonella, where the birds haven't been strongly immune, bacteria's been able to invade and cause clinical disease, we want to get salmonella out of as many of those birds as we can before we treat them. And the way we do, before we vaccinate them, and the way we do that is give them the sulphur AVS, but for a long time, and disinfect the loft. And we have to give it to them for a long time because salmonella is one of those nasty bugs where white blood cells come along trying to protect the body, engulf it, but the salmonella, once it's engulfed by the white blood cell, doesn't die. It lives inside the white blood cell, and once it's in the white blood cell, the antibiotics can't reach it. And so if you just treat a suspect salmonella infection for a very short time with sulphur, you know, any sulphur-based antibiotic or other drugs that kill salmonella, you won't eradicate. You need prolonged exposure to the antibiotic to have any chance of killing it. And even with the long courses, you still won't kill it from all of the birds. So with a normal race loft, 10 days, if there's been a history of salmonella. In racing lofts with active salmonella, or any fancy lofts, well, then you're looking at a really long course. You know, the way that salmonella gets into a racing loft, a new strain of salmonella, is through asymptomatic carrier birds, which most typically are returning race birds, and a contaminated environment. Yeah. It doesn't come from mice and rats, we know that now. You know, with the molecular biology, we can sequence out the salmonella that pigeons get. You know, it's a pigeon-specific salmonella strain, which is indeed the case with most other salmonella strains, like cow salmonella only affects cows and pig salmonellas only affect pigs. So pigeons actually turned out to be the same. So the PMV, the other vaccines, everyone's very familiar with that. The PMV vaccine, it's just 2 shots, 4 weeks apart, both given after 6 weeks of age. I'll just very quickly mention, very briefly before, that in those trials that we ran for 18 months, because the group of 60 were randomly divided into various groups that had the various vaccine combinations, some of those groups had cocks and hens in them, and so they mated and they bred, and so those young pigeons that were born through the vaccine trial, we started bleeding them as well from 10 days of age to see what immunity they had got from their parents through the egg, in the egg and through crop milk and things like that. And we found that most of those young pigeons had some immunity from their parents up to about 6 weeks of age. And if those young pigeons were vaccinated before that 6 weeks, some of those pigeons, that passive immunity from their parents, interfered with those young pigeons developing their own active immunity. So not all of them though, but what that means is if a first shot is given before 6 weeks of age, there's no guarantee that that will work. And so then if you just give a second, so you vaccinate them 4 weeks, might have worked, might not have, vaccinate them second shot, 8 weeks of age, 9 weeks of age, they might only be 1 shot pigeon, and if we think back to that initial shot, very transient short-term immunity. So if the first shot goes before 6 weeks of age, they may need a third shot. And I just mentioned a few things that come up in conversation. The cheesy lumps, we didn't know what they were initially, and so what we would do is just start to biopsy them. We just take a section of them, send them off to the lab. What are these? After we'd done about 25, we didn't do any more because they're always the same, and they're always just infection. And so people, when they're vaccinating, they just carry bacteria that are on the skin into the injection, or more commonly the needle goes a bit deep and touches the crop, and then you withdraw it and there's crop bacteria, just like injecting stomach content under the skin. You end up with a cheesy abscess there. There's some talk that the vaccine damages the immune system. We investigated that as well, because you can draw blood and measure, differential white cell counts. Pigeons have the 6 different types of white blood cells that are challenged in response to different immune exposures. The vaccine didn't affect that at all. That's an old wives' tale. And I mentioned the passive immunity. We did have a few people smuggling European vaccines, but I think that's, I don't think anyone does that anymore. There's no point. Goodness, unlawful, of course. The rota vaccine, that's a really interesting one. The pox is, single shot, lifetime immunity. It's a very effective vaccine. Everyone's very familiar with that. The rotavirus vaccine is really interesting because we didn't do a full study in 2020 like we did with the PMV, 18 months, 60 birds, but we did a short sort of pilot study. Mark White at Treadlier, who makes the vaccine, he paid for most of that, which was really good, and very generous as well. But we wanted to see, look, just what immune response do we get from the vaccine? Does it work? How high is the immunity? And what we found is that the antibodies there were much more fragile, much less stable with the PMV, and so they would sort of come up in some birds and then go down, and others would start to rise. There's obviously other immune factors at work apart from antibodies in the blood with rotavirus, and the suspicion is that there's actually immunoglobulins in the mucus at the level of the bowel that are also contributing to immunity. But the big thing to remember that with rota vaccine that's different than PMV is that with PMV, the pigeons stimulate enough immunity to completely stop the development of all clinical disease. They don't form enough immunity to stop them becoming infected with the virus. So PMV birds can still become infected and can still transmit the virus, but they don't get sick themselves. But with the rotavirus vaccine, it's very much like the COVID vaccine. You get immunity, but there's not enough immunity to completely block the development of clinical disease. So you'll still get some pigeons show signs after rotavirus vaccination if they're exposed to the virus, but the disease is much milder than it otherwise would be. And the other big thing which is really important is we had 3 fanciers in Melbourne, and these results were all published in the journal at the time, let us bleed some of their birds for biochemistry to evaluate the amount of liver damage in birds that had been vaccinated for rotavirus and hadn't been vaccinated for rotavirus if those birds were subsequently exposed to rotavirus. And what we found very much is that vaccination was terrifically effective at protecting from internal damage if the birds were subsequently exposed to rotavirus. The ones that had been vaccinated, within 6 weeks, all their liver values on the blood biochemistry came back to normal, where I can't remember the exact figures, but the ones that hadn't been vaccinated, initially they went up like 10, 12 times normal, and 6 weeks later they were still 2 or 3 times normal. They looked quite normal in the loft, but their liver values were still extremely high. Thank you, Kate. So pulling it all together, and so at 6, the vaccines can all be given at the same time. There's no reason why they can't. They don't interact with each other, and it's a drag having to pick them up again and again, I find. So it's a drag having to do them, twice anyway. It takes me most of the day for mine. But so it's after 6 weeks of 18, an injection of PMV, separate injection for rota, and just a 1/10 of a mil of the salmonella vaccine down the throat. And then 4 weeks later, same again, PMV and rota, salmonella down the throat, and I do them against pox then as well. So I have 2 vaccination guns. I don't have anyone to help me, I do it myself. I just hold the pigeon against my tummy and pick up one gun on one side of the neck, pick up the other gun on the other side of the neck, turn them around, put the salmonella down their throat, and let them go. So one-loft races and PMV, so this is where it's got really interesting, particularly over the last 12 months or so, because there's been some really challenging things that have been happening, and I guess the thing is that one-loft races are changing the whole dynamics of pigeon racing in Australia, because what used to happen is that my pigeons and your pigeons wouldn't come in contact with birds from many other lofts until the final training tosses before all birds or the club races or so. And by that stage, the pigeons are already 6 to 8 months old, so they're pretty refractory to many of the common bugs. You don't get eye colds and diarrhoea so much in 6 to 8 month old birds as you might in the young, recently weaned pigeon. But the thing with one-loft races is suddenly